So as I mentioned before, strokes can be classified into two categories, either ischemic or hemorrhagic. So I already talked about ischemic strokes, let's talk about the other one. So broadly, hemorrhages are bleeding where bleeding is not supposed to be, which is not a good thing even a little bit. So hemorrhagic strokes is bleeding in the brain when there is not supposed to be. So, hemorrhagic strokes are usually caused by a rupture of a weakened blood vessel inside the brain or central nervous system. It can be traumatic due to a brain injury, like getting hit on the head really hard, or non-traumatic due to other causes. Now, hemorrhagic strokes are really, really bad. Like, no stroke is good. Hemorrhagic strokes tend to be the worst out of the two kind of broad classifications of ischemic or hemorrhagic. If you are going to get a stroke, you really, really do not want to get a hemorrhagic stroke because they are much harder to treat and have much higher mortality rates. Hemorrhagic stroke are usually kind of the main calling card of a hemorrhagic stroke is a sudden, really, really, really bad headache. Like the worst headache that you could possibly conceive of. Like, you think your brain is going to actually explode out of your head. It's classified by that, as well as occasionally very sudden onset projectile vomiting with no prior warning of any nausea. Hemorrhagic fevers can also be further classified into two different categories. You can either have intracerebral or subarachnoidal. So intracerebral is actual bleeding into the brain tissue. A blood vessel within the brain, it ruptures and there is what is called a hematoma, which is basically a large amount of blood pooling in a specific area. Now, that is not good for multiple reasons, one of which blood in your brain where you do not want it, and two, since there is blood flowing into your brain from other areas of the body and it's not flowing back out, it causes a big increase of pressure, which is not good because when you have more pressure building in one specific spot, that pushes the rest of the brain tissue into other areas, which causes further damage in areas other than where the actual stroke is happening. Let's say, for example, you have a stroke in the temporal lobe of your brain. That is where the hematoma is forming, where the large amount of blood is pooling. That is causing an increase of pressure. Let's say you have it right over here. That is causing the tissues to be pushed this way, causing damage on this side of the head and also on the front and back, but largely going like that. So, as the stroke continues, more blood flows into the brain, causing the hematoma to increase in size, which increases pressure, which is overall very not good. Now, the second type of hemorrhagic stroke is called a subarachnoidal stroke. So, you have what's in your brain called meninges. Well, not technically in your brain, but it's this brain structure called meninges. They are basically a bunch of layers of protective coating to protect the brain from things like infections and also from damage from like rubbing up against the skull. In the subarachnoidal hemorrhage, there is a ruptured hemorrhage which causes bleeding in between some of the layers of the meninges, usually between the pia layer, and the arachnoidal tissue layer. So subarachnoidal is below the arachnoid tissue and above the pia, but whatever. Now with this one, there's no actual bleeding into the brain tissue. It is in between the layers of the meninges and also follows the cerebral spinal fluid, so it flows into the ventricles of the brain, which are kind of the spaces where there's no actual brain tissue, it's just cerebral spinal fluid. So now this one doesn't actually cause as big of a mass effect because it's flowing into a space, so it's not actually pooling within the tissue. There is no blood within the actual brain tissue in this type of stroke. It's still not good, but it doesn't have quite the pressure effect, so it doesn't affect the healthy tissue nearly as much. Now, ischemic and hemorrhagic strokes are usually considered to be opposite conditions, where one is caused by blood flowing too much, the hemorrhagic, and one is caused by blood clotting too much, the ischemic. However, the ischemic stroke can potentially turn into a hemorrhagic one if the blood clot causing the ischemic stroke causes the blood vessel that it is in to burst, turning the ischemic stroke into a hemorrhagic stroke. Because if the pressure in the blood vessel is increased too much because of the blockage, then it could potentially burst, causing the blood to go other places, causing a hemorrhage. Now, this causes problems beyond the original stroke because they are considered to be two opposite conditions, so that means there's two opposing treatments. With the ischemic stroke, you often want to give anticoagulants and antiplatelets to try to get the blood clot to dissolve on its own without needing surgical intervention. However, if you are giving anticoagulants to somebody who develops a hemorrhagic stroke, that will cause even more bleeding because the blood is not clotting, causing it to flow even more, which is not good when you are actively bleeding and don't want to be. So kind of the treatment for hemorrhagic stroke is mainly supportive treatment, make sure airways are still functioning and oxygen is getting placed it needs to. Sometimes you can surgically repair the burst blood vessels, that's not always the case, and sometimes you need to do a craniotomy in order to remove parts of the skull to avoid the pressure becoming too much and causing further brain damage. But mostly what you have to do is just kind of wait and hope that the patient recovers with minimal brain damage.